Good morning. My name is Lee Goodman. I'm the EMS Director here at Trumbull EMS. I'm here today just to talk to you a little bit about our 911 responses and some of the changes we've noticed during pandemic COVID-19 and how to help you recognize when you should be calling 911 and reassure you about the processes and procedures that we're following in order to keep you and our providers as safe as possible. Recently, we've noticed a small drop in people who are calling 911. And more so, we've noticed that when people are calling 911, they're calling usually a little later than they normally do. And that's causing us some concerns. In talking to some of our patients, we are hearing fear and concern on their behalf in terms of not wanting to call 911 for fear of infection and not wanting to go to the hospitals for that very same reason. So we wanted to reassure you that we are taking many steps in order to make sure that our ambulances and our crews stay safe and that we are able to in turn protect our patients. It's very important that if you are experiencing a life-threatening emergency that you call 911 immediately and get help to you as early as possible. Many situations such as a heart attack or having a stroke really rely on early intervention. The sooner that we can get there and start treating you and take you to the emergency room where you can get the appropriate definitive care counts as getting us there as soon as we can. So we wanted to let you know and maybe show you a little bit around our ambulance and what we're doing to keep it clean. We take disinfecting protocols and procedures very seriously, and we've been doing that since prior to the pandemic. But obviously, in the face of an emerging infectious disease, we take a few extra steps just to make sure that we can pick up a patient and safely transport them to the hospital, and then disinfect and decontaminate our entire ambulance to make sure that when we go to pick up the next patient, that next patient is safe and secure. The other thing that we do is we make sure that our own staff are taking every precaution to make sure they don't pick up COVID-19. And that starts with some very simple, basic personal protective equipment that they wear on all calls. Every time that we go on a call, all of our staff will wear the very minimum, a surgical mask. And before they make patient contact, they will give a surgical mask to that patient and or any bystanders that might be in the room. Additionally, we have respirators, N95s. I'm sure many of you have heard of them by now. We have different models. Each model is fit tested onto our staff to make sure it fits them appropriately. We have Tyvek suits, gowns, booties, head coverings if needed. We always wear gloves. We have face shields, face goggles. So depending on the signs and symptoms that you have, our crews will make a decision as to how many layers of personal protective equipment are appropriate for them and for you. And we will still be able to administer really good, high quality patient care for the signs and symptoms that you're experiencing. But what those protective measures do is they make sure that our staff members cannot transmit anything to you, even if they perhaps had something with no symptoms. So we go ahead and make sure that we take those steps. Even in our building here, our staff always wear face covers, and we've been doing that since probably mid-March. We've been following all CDC guidelines and taking everything just that one step further. So whatever the guidelines are, we try to do just one extra layer to really take that extra step. We want to make sure that our staff do not bring any infection into your homes or to the care environments that we go into. And subsequently, when we take you in, we want to make sure that anything that you might be experiencing isn't transmitted to our team or anyone else that we might come in contact with. So I'm here with one of our EMTs, Jen, and we just want to show you a little bit about the precautions that we take. So usually, as you can see, I'm wearing a surgical mask, and so is Jen. When we're around the building or we're in close contact with each other, we will always have one of these surgical masks on. And for every single call that we go on, even if the call came in saying we just need some help getting up because we fell and we have no injury, we will always wear that. The next layer that we have is this gown right here. We have these. We also have Tyvek suits, which is a version of this, but it also has a big hood and booties. We have them in all sizes, and they create just a good protective layer, and we can then take them off, and any germs that were on them are not going to get passed on. We always wear our gloves on every single call. And those get changed even within the call. So once they're contaminated, we safely take them off and would put a fresh pair on. Once we get inside and we assess what's going on, or even occasionally before we go in, based on what you've told our dispatcher when you call 911, we can upgrade the level of protection that we use. So you might see us wearing one of these N95 masks that we have. And we have a few different versions of them. These are our half-face reusable respirators that we issue to our team members that are here fairly frequently. And so they can wear these with interchangeable filters or those. And the next step is eye protection. The CDC always says they want us to wear an N95 and face protection. So we have goggles or we have these shields. Jen would normally have a partner working with her, so when the partner goes to drive to the ambulance, they actually safely take all of that equipment off. They dispose of it, and they seal off. Our ambulance gets sealed off. We have HEPA filtration systems in our ambulances. And then when they get to the hospital, they put on fresh protective gear to assist in transferring the patient care over to the emergency department. Once we finish that, our providers actually come out, they doff all of that gear, safely dispose of it, put on another set of gear to decontaminate our ambulances. And we can talk a little bit more about what we do when we decon our ambulances in between each call and back here at the base.
After we transport a suspected COVID patient, we basically take the following steps to ensure that our ambulances are clean and disinfected and ready for our next patient. Once we drop our patient off at the hospital, all of our ambulance doors are open in the hospital bay. We have CDC-approved disinfecting wipes and sprays that we use on every surface in the back of the ambulance. As the chief said, we take off all of our contaminated PPE, we change our gloves, we put on new PPE, and we start the disinfecting process. It could take it takes approximately about 15 minutes for us to fully decon our ambulance. We use the sprays on all of the glass windows and seats, and we also use it on our stretchers. Everything dries and kills all possible respiratory droplets or infection points on contact. During transport, we have an exhaust system in the ambulance which is turned on, and all of our cabins are sealed to protect the driver and if there is another passenger in the passenger seat. In our downtime here, when we get back to base, we pull all of our ambulances out. We have bleach solution that was provided by Home Depot to us, and we're able to spray the floors and do an additional decontamination, and even more thorough clean on top of what we would do in between calls on a daily basis.
So I also wanted to just touch base on a few of the signs and symptoms of a life-threatening emergency, just to encourage you to be cognizant of these symptoms and to call 911 immediately if you or a family member or someone that you're with is experiencing these symptoms. If you're not sure, we encourage you to call us. Even if you call us and we get there and there's no need to go to the hospital, you don't have to go, and we're more than happy to assess you, take your vital signs, and talk through whether we think it's appropriate for you to go to the emergency department or not. But we want you to be mindful of things that might be the signs and symptoms of a stroke. For example, sudden onset weakness, dizziness, confusion, feeling like you're unable to articulate or get your words out, almost like a word salad, your words are all scrambled up. Sudden weakness to the left or right side of your body. Those are all very important signs that you might be having a stroke. If you're suddenly unable to smile, if you hold out your arms in front of you and one droops more so than the other, it's really critical that you call 911 immediately. We also want to think about the signs and symptoms of a heart attack, any chest pressure, chest discomfort, numbness or tingling to any of your extremities, jaw pain, nausea, vomiting, just weakness, feeling like you're about to pass out or actually having a moment where you do pass out. Those are all signs and symptoms of a heart attack, and we encourage you to call 911 immediately. Early intervention is so important. We often find that we get there and they tell us they've been having that chest pain for 1 day or 2 days. Please call us at the first sign of that chest pressure. Even if you've been outside doing yard work and you're trying to work out if it's a muscle pain or a cardiac pain, call us because we can really help to get to the bottom of that. And when it comes to the heart and the brain, minutes count, okay? If there's something blocking your arteries, it means that oxygen isn't getting through and your heart is being damaged. And the longer you wait and sit and let that blockage go on, the more chance you have that that damage is irreversible. So we really want to get there early, and if it is a problem, we want to start to treat it so that we can potentially turn it all around before it becomes life-threatening. Confusion is always important. If somebody you're talking to, they suddenly aren't making sense, they're confused, that is the signs and symptoms of a stroke or another critical thing. If you're suddenly falling a lot and you're someone who doesn't normally fall, multiple falls can be an early warning sign that it might be something cardiac or it might be an infection that we want to get on top of before it gets serious. We don't want you to have septic shock, which is when you're fighting an infection and you don't get to it in time and things get really worse and your whole body starts to react more systemically with that infection. So we want to get in early and start the treatment and take you to the hospital. I just wanted to take some time to introduce you to our partners from Bridgeport Hospital today. We're here with our Quality and Operations Officer, Dr. Cahill, and the Chairman of the Emergency Department, Dr. Ferrigno. And we asked them to talk with us a little bit about what they're doing inside the emergency department once we transfer patient care to them to help take care and keep you safe during pandemic COVID-19.
We're socially distanced now, so I can take my mask off, but this is our first line of defense against coronavirus in the hospital. You'll see all of the providers and nurses are wearing masks at all times, and every patient is asked to wear a mask as well. Before your arrival, we get communications from the EMS crews. Anyone with suspicious symptoms will be isolated for coronavirus precautions, but not just those patients. Everyone is kept as isolated as possible, and we re-triage every patient who arrives to assess their symptoms for coronavirus. After the patient arrives, everyone who participates in their care will be using precautions to stop the spread of coronavirus, including masks, gloves, and frequent hand washing. Whenever a patient is discharged or admitted to the hospital, the ED room is thoroughly cleaned using antiseptic wipes and a process using UV light to assure that the room is clean for the next arrival.
All right. Hi, I'm Dr. Rock Ferrigno. I'm the chairman of the emergency department at Bridgeport Hospital. I'm also the associate chief medical officer. Really want to ask you to think about our care as being incredibly safe. We've focused on having our care be world-class care, never safer. We've done tremendous work in our operations and the way that we approach your patient care to make sure that when you arrive here, you're going to be treated safely. You've heard from Dr. Cahill about some of the processes that we've used so that when you arrive, you are brought to a room, and if you have symptoms, that you're kept completely alone. We have our entire staff using masks, many of which are using goggles. We're using hand washing after every patient encounter, and we've had tremendous experience with COVID because we're part of an academic medical center. It allows us to have familiarity with the ailment and allows us to understand how we need to keep you safe and also keep us safe. If you look at our entire campus here, we've only had 0.25% of our staff contract COVID virus ailment here. That means that we really know how to keep the virus away from us contracting that virus, and keep you safe. If you're feeling any sort of ailment, something that needs to be addressed, please seek your care with us. We're a safe environment for you, and we're working every day, every night, all the time to understand how to keep you safe while you're here.
Good morning, everybody. I'm here today with our partners from Hartford Healthcare St. Vincent's Medical Center, and I wanted to introduce you to two of our good friends that we partner with in pre-hospital medicine. Chair of the Emergency Medicine Department, Steve Velasquez, is with us today, as well as our EMS coordinator, Terrence Sheehan.
We were asked to, come out here and just say a few words regarding calling 911 and going to the emergency department. COVID is, frightened us all to the point where we're kind of afraid to call 911 in the event that we're having a potentially life-threatening emergency. So from my perspective as the EMS coordinator here, I want to urge you to go ahead and not wait to call 911 if you're experiencing any signs and symptoms of a potentially life-threatening emergency. Things like chest pain, shortness of breath, headache, dizziness, if you pass out. Things like that do warrant you to go ahead and call 911 at least to get an evaluation from your local EMS teams, and then you can work with them to decide if going to the emergency department is appropriate for you. But I do want to encourage you that waiting in those life-threatening situations is probably not the best thing to do.
I appreciate the opportunity to speak and to work with Trumbull EMS. I think the message that emergency physicians are trying to get out there is that people are staying away from the hospital when they truly have emergencies. We all anecdotally have seen people who have come to the hospital when it's too late and their condition is much worse because they waited. The hospital right now is very safe. Our numbers, when we look at them every day, we've had 0 or 1 patient or 1 potential patient in the hospital at a time. So it's very safe. In terms of the guidelines, we follow all the CDC guidelines here. All our employees are screened daily. We have temperature checks, we have symptom checks. We've redesigned our emergency department and the hospital floors, so patients who may have coronavirus or are at risk are isolated in separate areas and not in with the general population to protect anyone from catching the disease, both patients and staff. And we've done a tremendous job here keeping our staff healthy through this time. One of the questions that we've been asked is, are visitors allowed in the emergency department? Are my loved ones able to see me while we're here? During the height of COVID, most hospitals didn't have visitors, but we feel like we're at a safe place right now where you can have a visitor in the emergency department. We are limiting it to 1 person at the bedside, and then that's 24 hours a day. So if your loved one is sick, if they are worried that they have a serious condition, they can come to the emergency department and they can be comforted by knowing that they have someone at their bedside to be there with them. So in conclusion, I think the important message to get out there is twofold. If you feel that you have a potential emergency, you shouldn't wait at home. Call 911. You will be safely brought to the emergency department, safely cared by our EMS partners, and you'll be safe in the emergency department during your care. And secondly, the message for everyone to take home is to continue wearing your masks, be smart, social distancing is important, and together we are going to tackle this. Thank you.
So when you do call 911, there are a few things that you can do to help us reach you faster and to send you the most appropriate resources. So first and foremost, our dispatch system will ask you quite a few questions, and we encourage you to answer them as calmly and as articulately as you can. Please know that when they are talking to you, they are at the same time simultaneously dispatching our paramedics and EMTs to your location. So a lot of people seem to think that they need to finish talking before they'll actually send us. But in fact, they send us and then they keep trying to get as much information as they can so that they can help our crew find you easily and bring in the most appropriate tools that we would need to treat the type of emergency that's going on. If it's a medical cardiac call for your heart, if it's more of a traumatic injury because of a fall, they give us that information and it helps us bring in the most appropriate tools to treat you. We do encourage you to help us find you more easily. Go out today after watching this, check to see from the road, can we see the number of your house? Is your driveway clear? Is there a clear pathway to the doorway? If there are vehicles in the driveway, potentially if you have more people on hand to assist, move the vehicles out of the way for us so that we can back the ambulance in as close to the doorway as possible to help us extricate your loved one from the residence and into our ambulance as promptly as we possibly can. If you have pets, we encourage you to pop them into a crate or put them safely into another room. We absolutely love pets, so first and foremost, we don't want to get distracted. But really, we just don't want them to run out and have to worry about something happening to your furry best friends whilst we're there. They're also very protective of you, and when they see us trying to help you, they might see us as a threat and come and try to protect you. So secure your pets. If it's at nighttime, put the lights on, help us find you very easily. Make sure that there's things that are out of the way. So if you're upstairs, try to clear a pathway for us. Remember, we have equipment, big stretchers, a stair chair, a lot of tools. So the quicker we can get to you by having a clear pathway in and out of your home is really very, very helpful for us. Try to tell us where you are in the house if you're by yourself, just so that we can try to find you as promptly as we can. We encourage you to have a backup plan in place so that if you are alone, we would be able to access the house. If you leave a key somewhere where you can tell our dispatcher where to find the key, if you have a life alert system that you can press and they can help us get into the property. And we encourage you to have your medical history and a list of the medications you currently take handy. Trumbull EMS has a form that we can provide for you if you need, and you can actually fill that form out. You can save it on your computer and update it every time you see your primary healthcare provider. And this really does help us when we're treating you. If we're going to give you medications, we want to make sure that the medications we have are not going to cause an interaction with one of your current medications. And just understanding what your medical history is, because some of what is in there could be pertinent to what's going on right now, and it will help us give you the most appropriate treatment. So having that information handy, really helpful. If you're able to have your medical insurance and ID close by, that simply helps us pass that information on to the hospital and just gets the ball rolling so there's less pressure and stress on you after the event as we get the logistics squared away. So if you have that handy, we do appreciate it. If you don't have it, not a problem at all. It's important to know that Trumbull EMS will come and deliver care to anyone who calls 911, regardless of your socioeconomic status, regardless of any race, gender, sex. Everybody will receive the same high quality emergency care, no matter what the circumstances. And your ability to pay a bill or not pay a bill is never considered when you dial 911. You will always be treated, we will always transport you, and our local emergency departments will always give you the highest quality care no matter what.